Treatment options for cerebrospinal fluid venous fistula depend on the severity of the condition. Options include observation, embolization, and surgery. In some cases, observation may be recommended. This means that the patient is monitored over time to ensure that symptoms do not worsen. This approach may be recommended for people who have a mild form of the condition and are not experiencing significant symptoms. Regular monitoring is necessary to ensure that the condition does not progress. Embolization is a minimally invasive procedure that involves blocking the abnormal connection with a small coil or other material to prevent cerebrospinal fluid from flowing into the venous system. The procedure is performed under local anesthesia and requires a small incision. The doctor uses a catheter to guide the coil or other material to the site of the fistula, where it is deployed to block the abnormal connection. Embolization is a safe and effective treatment option for cerebrospinal fluid venous fistula and has a high success rate. In some cases, surgery may be required to repair the abnormal connection. Surgery is typically reserved for cases where the fistula is large or complex, or where embolization is not possible. There are several surgical techniques that can be used to repair a cerebrospinal fluid venous fistula, including craniotomy and endoscopic surgery. Craniotomy. This involves opening the skull to access the site of the fistula. Endoscopic surgery. This involves using a small camera and specialized tools to access the site of the fistula through a small incision. Surgery is typically performed under general anesthesia and requires a hospital stay of several days. Recovery time varies depending on the complexity of the procedure. In conclusion, treatment options for cerebrospinal fluid venous fistula depend on the severity of the condition. Observation, embolization, and surgery are all effective treatment options, and the choice of treatment depends on the specific circumstances of each case. It is important to work with your doctor to determine the best course of treatment for your individual needs. Cerebrospinal fluid venous fistula is a rare but serious condition that requires medical attention. If you experience any of the symptoms we discussed today, make sure to see a doctor for a proper diagnosis and treatment. Thanks for watching.